Exotic dancer killed at Santa Cruz nightclub. Police say a suspect has been arrested after an exotic dancer was stabbed to death early Saturday morning at a nightclub in Santa Cruz, St. Elizabeth. Police identify her as 34-year-old Nikisha Francis Monfort, a resident of Queensway Yellow St. Thomas. Sources confirm her stage name as Chocolate. Preliminary reports are that about 2 a.m., the dancer was at a Spenless nightclub when there was an altercation with a man and a knife was used to stab her. She was taken to the hospital where she was pronounced dead on arrival. Head of the St. Elizabeth Police Superintendent Coleridge Minto said detectives processed the crime scene and acted on intelligence, tracked the suspect to a premises in Santa Cruz where he was arrested. The quick actions of the police led to the arrest of the suspect. He was picked up and the knife believed to have been used was also seized, Minto noted. The incident has increased the number of murders so far this year in St. Elizabeth to 7 when compared to 18 for the corresponding period last year. St. Elizabeth is among the police divisions with the lowest murder recorded so far this year. Trelawney has so far recorded 6 murders and Portland has recorded 7. Tufton urges pregnant women to prioritize healthy lifestyle and maternal health concerns. Minister of Health and Wellness Dr. Christopher Tufton is urging pregnant women to embrace healthier lifestyle practices and attend regular checkups, stressing that early intervention is key to ensuring the well-being of both mother and child. Tufton made the appeal on Friday while speaking at the groundbreaking ceremony for the new Ocherest and Brownstone Health Center in St. Anne amid heightening public attention following recent reports of infant deaths at Victoria Jubilee Hospital. We really need to get maternal mortality down to about 70 or 80% 100 births based on the World Health Organization standards, Tufton noted. We have work to do, but we're moving in the right direction. He revealed that maternal mortality, which spiked during COVID-19 pandemic in 2021, is about 200 deaths per 100,000 births, fell to approximately 130 per 100,000 births last year. Despite the improvement, Tufton acknowledged that Jamaica has a long way to go. Tufton cited hypertension, obesity, cardiac arrest, sickle cell, sepsis as the leading contributors to high-risk pregnancies, noting that many of these conditions are linked to lifestyle. We're not blaming anybody for anything, let it be very clear, he stressed. We have to educate, inform, and encourage our families, mothers, and their partners to seek help early at least to ensure they are experiencing a normal and healthy pregnancy. He emphasized that primary health care must be strengthened to better serve communities, particularly when it comes to maternal and child health. Tufton shared that premature birth can be caused by several factors, many of which can be managed with early detection and proper clinical care. The construction of the 2 new health centers in Ocherest and Brownstone is part of the government's broader initiative to build a more efficient and responsive primary health care system across the island.
It is very sad that we have had the recent announcements around the increase or unusual numbers at the Victoria Jubilee Hospital. I have not commented as much on it, but I am equally concerned as Minister. I've allowed the clinicians, the Chief Medical Officer, the Regional Health Authority, and the Regional Technical Director, who have primary responsibility for this issue, to brief me based on the technical consultations that they have had. But there are some challenges that we're going to have to confront in a more substantial way. I'm linking it back to what has been identified, at least preliminarily, as the cause of the surge. That's this particular surge at Victoria Jubilee. We have a society that has to manage, and primary health care is key to this, more lifestyle-related illnesses, because there is a direct relationship between lifestyle and how it affects us as a person. And in the case of the expectant mother, it also affects, of course, the unborn and later the child. And we want to encourage our pregnant ladies to present themselves and to benefit from the guidance that the system has to offer once you know that you are expecting a child. When you look at some of the risks that contribute to high-risk pregnancy, we have to be concerned that we have to educate, inform, and encourage our families, mothers, their partners to seek help early, at least to ensure that they are experiencing a normal and healthy pregnancy. Because when I look at the data as the major causes of high-risk pregnancy, hypertension, obesity, cardiac disease, sickle cell, sepsis, thrombolism, these are issues that are related to lifestyle. And we're not blaming anybody for anything. Let me be very clear for the record. What I'm saying is primary health care is about community. And all of us within the community have a responsibility to give support to families and emerging or evolving families as it relates to pregnancy and the management of pregnancy. Because premature birth can be the cause of several things.
DCS and Heart NSDA Trust signed agreement aimed at strengthening inmate rehabilitation. The Ministry of National Security, through the Department of Correctional Services, has undertaken a new initiative aimed at strengthening inmate rehabilitation efforts. This is an agreement that was signed with Heart NSDA Trust. This partnership will focus on providing vocational training and certification programs to staff, wards, and inmates within the correctional system. Managing Director of Heart, Dr. Tanisha Ingdington, said the aim is to certify at least 1,000 inmates and juvenile wards. Meanwhile, State Minister Juliet Cuthbert-Flynn says it is hope that the program will help with reducing recidivism.
In year one, our goal is bold but clear. It is to train and to certify at least 1,000 inmates and juvenile wards. Together, we will build tailored curricula in partnership with the Department of Correctional Services. We will train mentors for the We Transform program. We will upskill correctional officers. We will support national projects like Live Good and the Citizen Security Plan Phase 2. A joint governance committee will oversee every phase, measuring the outcomes, ensuring transparency, and driving results. International models like Norway and Germany have shown that rehabilitation anchored in skills training can bring recidivism below 30%. We believe Jamaica can do the same our way with our people and for our future.
We are not sending these young men and women into society as bare men, but we are equipping them with the necessary tools and valuable skills that they will need to survive. By equipping them with vocational skills and certification, we enhance their employability and contribute to reducing the recidivism rate. That's why we're here. This is indeed a significant move for DCS. In order for us to be successful in our rehabilitation effort, we must equip our staff, equip the mentors with the necessary tools, and rehabilitation is not a one-man mission. It takes collective effort. It takes reinforcement.
Henley and Scott Mortley in heated Senate exchange over alleged threat. Government Senator Abaka Henley and opposition member Dana Scott Mortley clashed during Friday's sitting of the Senate after Scott Mortley accused Faith of making a threatening comment. Abaka accused his colleague of dishonesty, saying that is a bold-faced lie and I urge her to retract it. Senator Scott Mortley dismissed the demand, insisting Fitzhead knows what he said. She added, "It leaves no impact on my soul because it can only hurt or demean me if it comes from somebody who I hold in high regard." Senator Charles Sinclair, who was presiding at the time, told the chamber he did not hear the alleged remark. He also warned members against making muttered or off my comments that may not be heard and cannot later ruled out. Scott Mortley then left the chamber. She had indicated that she would leave the sitting early because of a personal matter and said she had asked Abaka Fitzhead to present before her so she could respond. Since he has threatened to assault me in the chamber with his words, Senator Kamina Johnson-Simit, she said. Johnson-Simit is the leader of government business in the Senate. Scott Mortley told her that I did not intend to convey, as she interpreted, as it was a physical threat. Later on the sitting, Fitzhead criticized Scott Mortley for saying the government was seeking to avoid tabling of the Integrity Commission's annual report by having Parliament break early for the summer. The suggestion that the administration was moving to terminate the parliamentary year to circumvent the tabling of documents by the Integrity Commission is a barefaced lie. It is false, and it must be called out of what it is, he noted. The Integrity Commission's annual report for April 2024 to March 2025 was tabled on Friday. Tensions between Fitz and Scott date back to at least September 2023, when Fitz headed during a political event referred to Scott Mortley as a twist-up one, prompting backlash from the PNP women's movement. The group condemned the remark as derogatory and called for a public apology. Henley later retracted the comment and offered an apology, telling reporters that it was intended as a response to what he described as a vicious attack by Scott Mortley. To subscribe, like, share, and click the notification bell for daily updates.